Good afternoon. The study I want to talk about today is Going Through Life on Hard Mode, research by Blandine French and Sarah Cassidy. In the United Kingdom, around 2.5 million people live with undiagnosed ADHD or autism. Both of these conditions overlap considerably. ADHD is characterized by difficulties with controlling impulses, sitting still, and focus, which can get in the way of everyday living. Autism is a condition that influences the way someone connects with others, responds to change, and experiences the world. Those with autism often have strong personal interests and a different relationship with sensory input when compared to neurotypicals. Whilst both are developmental conditions, many people do not receive a diagnosis until their adulthood. It is believed that both conditions remain underreported across the world, which has various negative consequences. Evidence shows that adults with undiagnosed ADHD or autism are more likely to have problems with schooling, experience depression and anxiety, and are at a higher risk of substance abuse and committing crimes. Since most healthcare systems require a person to receive a diagnosis before they can access support, receiving a diagnosis earlier in life could help considerably to alleviate this harm. So, how did the researchers do this? By speaking with 20 people in total in an interview format. For analysis of the data, the authors used reflective thematic analysis. This involves reading through interviews, picking up patterns across the participants, and then grouping those patterns into broader themes. It is reflexive as the researchers' own life experiences influence which patterns they uncover. One of the authors later noted her own ADHD diagnosis. After each interview, the researcher transcribes it word for word, reads it to understand what is being said, and then starts labeling recurring ideas, gradually grouping similar ones together until themes emerge. To lend support for her findings, a second researcher independently checks the coding and themes across the original interviews. A strong agreement was observed between both researchers. The study was also influenced by an advisory group of 9 adults who'd themselves been diagnosed with either autism or ADHD. These people helped design the interview questions to ensure the appropriate topics were being asked. Five themes were apparent after listening to the interviews. The first theme was relationships. Growing up undiagnosed often meant being misunderstood by teachers, partners, and family. Some participants were mistreated in their earlier life as their behaviour was inconsistent with other neurotypicals. Post-diagnosis, many found their relationships improved. Those around them were able to understand why they behaved the way they did, and some participants found communities during the study of which had received the same diagnosis. The second theme was mental health and well-being. Each person interviewed said their mental health had been affected. Anxiety and depression were both common before diagnosis, as participants noted feelings of being broken or not good enough. Many noted feeling calmer, safer, and more in control of their emotions upon receiving their diagnosis. The third theme was understanding. This was the most significant benefit which the participants described. A diagnosis gave the participants an explanation for why their lives had felt much harder when compared to others. It also aided in their understanding of their own strengths and weaknesses. The fourth theme, the burden of a label, was not as positive. Post-diagnosis, many people experience stigma, being stereotyped, or even have their diagnosis questioned by others. The fifth theme, timing and readiness, was surprising as most people didn't wish they'd been diagnosed earlier. People were less understanding of neurodivergence in previous decades, and many felt that an earlier diagnosis might even have caused them harm. What mattered more to the participants was not when the diagnosis came, but whether the person was ready to receive their diagnosis, both emotionally and in their life experiences. This study presented with several strengths and weaknesses which should be discussed. The biggest strength is that to the presenter's knowledge, it is the first to look at ADHD and autism together. The researchers thought their experiences overlap so much that they should be collated. It also brings together diagnosed adults and healthcare professionals, which provides a clearer picture when compared to similar research. However, the study yielded a small sample of 20 people. These findings may not be consistent with the broader population. Another limitation is that the researchers never spoke to family or partners, who might have seen the influence of their diagnosis differently and provided new knowledge and insights. Lastly, the interviews were captured at a single point in time using a cross-sectional design. A person's perception of their diagnosis and relationships with others may change over time, which might have a bearing on what is being described in interviews. Yet, the design of the study prevented researchers from gauging whether this had occurred. So, what is the takeaway? This study shows that a late diagnosis can change a person's life. It provides an explanation for their behaviour. Once people understood why they had struggled previously, they were able to stop blaming themselves and then develop healthier relationships and self-acceptance. Thank you for listening to my presentation.